I've been in Washington for 30 years. I don't recall any piece of legislation that has engendered such strong feelings on both sides as health care reform, and a lot of misinformation. Half of Americans believe health care reform includes a new government-run health plan. A third of Americans believe we've set up this special panel in Washington that's going to tell you when you get sick whether we give you medical treatment or just leave you next to the road to die. Neither of those is true. Health care reform has 5 major elements. The first element is what we call an employer mandate. Every employer has to provide comprehensive insurance to all its employees or pay a special tax to the government. We call this pay or play because every business has to choose. Either you pay the tax or you play. You provide health insurance. Businesses with fewer than 50 employees are exempt from this requirement. They don't have to pay. They don't have to play. The second element is an individual mandate. Every single American must have health insurance. And if you don't get it from your employer or under Medicare, you must go out and buy it on your own. And if you don't buy it on your own, you too will be subject to a penalty. The third element says when you go to buy your insurance, you will get it. You can't be denied coverage based on the state of your health, based on pre-existing conditions. Fourth, every state is setting up an exchange where people can get information about various insurance policies and buy them at competitive prices. And then finally, there are government subsidies. If your family's income is under $88,000 a year, you get a subsidy to buy your insurance. And if it's under $30,000, you get it for free. Those are the 5 elements of health care reform. Now, a number of states and individuals have challenged the constitutionality of the second element, the individual mandate, saying Congress doesn't have the authority to force private citizens to buy insurance. That's a decision we should each make for ourselves. I'm going to have to get a little lawyery on you here. I know this is tough late in the afternoon. Just try to keep your eyes open for a few more minutes. Congress passed the individual mandate under something called the Commerce Clause of the Constitution. The Commerce Clause allows Congress to regulate interstate commerce, to affect things that cross state lines, that affect the country as a whole. And people challenging this law say, what interstate commerce? I'm sitting in my living room, I'm calling the insurance guy down the street, I'm deciding whether to buy insurance. Typically, not always, but typically, at least till now, the Supreme Court has deferred to Congress on what constitutes interstate commerce. The most recent case 2 years ago was a law Congress passed regulating the growth of marijuana in the backyard for medicinal purposes. That sure seems pretty local, but the court said that affects the drug trade. The drug trade's a national issue. Congress can regulate it. Those precedents certainly give the court the leeway, if it wants to uphold the constitutionality of health care reform. Because whether people have health insurance affects the cost of health insurance, that affects the cost of health care. That's clearly a national issue. But as we saw during oral arguments, justices consult their convictions as much as the precedent, and a number of justices expressed misgivings about this law. And what they said was, look, all those other laws in the past, they told people what they could not do. They cannot grow marijuana. This law is telling people what they must do. They must buy insurance. And that troubled a number of justices, including Justice Kennedy, who is considered the swing vote here. And what he said was, well, how is this different from the government telling us we have to eat broccoli? It's good for us, but surely they can't tell us that. So this is what's happening inside the Supreme Court right now. The 4 justices that want to uphold the law have written an opinion. The 4 justices who want to strike down the law have written an opinion. And they are descending on Justice Kennedy's chambers. And they are trying to convince him if they make certain changes, will he sign on with this one or that one? And what he has to be convinced is that telling people they have to buy insurance is different from all the other things the government might tell us to do. Why is it different? I don't know. Maybe because we all need health care at some points in our lives. If he thinks that this is different, he will vote to uphold it. But if he thinks this is just like the government telling us to eat broccoli or buy electric cars, he's going to say this is a bridge too far, and he's going to strike down the law. So it's going to be a very, very close case. Now, if they decide to strike down just the individual mandate but uphold the rest of the law, then we have a true mess. because a lot of other parts of the law, including parts that have bipartisan support, rely on the individual mandate. In particular, the requirement that insurance companies cover pre-existing conditions. Insurance companies will do that only if they know everybody's getting insurance. And Congress is going to be in no position this year to fix the law. You have to wonder if they'll ever be able to fix such a polarizing issue. So that will leave us in a bit of a mess if they strike down just the individual mandate rather than the whole law. Now, my concern about health care reform is a little different. My concern is that if health care reform is upheld either in whole or in part, it's going to have a very negative effect on the budget deficit. Using the government's own numbers from the time this law was passed, in other words, the most conservative numbers, health care reform costs $1 trillion. Yet it is revenue neutral, doesn't add to the deficit. Why is that? Well, half of that cost, $500 billion, is made up with a new tax that begins next year. Next year, your clients who have family income over $250,000 will have their investment income, interest, dividends, capital gains, subject to an additional tax of 3.8%. Now, that additional tax on investment income will not apply to non-taxable income, like tax-exempt municipal bond interest. It will not apply to money taken out of retirement plans, like IRAs and 401ks. But otherwise, next year, investment income taxed at an additional 3.8%. That brings in $500 billion of new revenue for the government. The remaining $500 billion cost of health care reform is made up by reducing Medicare outlays, forcing doctors and hospitals and drug companies to take less money under the Medicare program. Well, if you pay doctors a lot less money to see Medicare patients, what do you think happens? They don't see them, that's right. And you end up with rationing. Because a senior that's sick can't get in to see a doctor in a timely manner, there aren't enough doctors who will see them. Congress hates that. Every time there's a scheduled cut to Medicare reimbursement rates coming along, Congress passes a law that overrules that cut and keeps the rates where they've been. Since health care reform was passed with this provision in it, Congress already has overridden the scheduled cuts to Medicare 4 times. And it's quite clear they're going to keep doing that. Well, that's great for seniors. They'll be able to see doctors. It's terrible for the deficit. We've now added $500 billion. And that's using the government's own numbers. I believe it will be worse because the system will be gamed. Many employers will not provide health insurance to their employees and will choose instead to pay the penalty. The penalty is very low. It's $2,000 a year per employee, much cheaper than providing insurance. Now, in the past, employers provided insurance because they had employees who were uninsurable, who couldn't get insurance elsewhere. That's not a problem anymore. Now everybody can get insurance. I think many employers don't provide it. They pay the penalty, save some money, maybe share some of that money with employees, give them another bonus. Everybody walks away happy. That means people have to go out and buy insurance on their own. And if you're healthy, I don't think you bother. I think you, too, pay the penalty. The penalty on families is low, $2,000 a year per family, $750 if you're single, cheaper than buying insurance. Instead, we all wait till we're sick, then we go to the insurance company and say, I'm sick now, I want my insurance, and they have to give it to you. That means only sick people have health insurance. You don't have to be an actuarial genius to think that might not be a good system. Either insurance companies raise their premiums sky high, or more likely, they exit the business and the federal government ultimately has to take over health care. That's my concern about health care reform. If you think health care is expensive now, just wait till you see how much it costs once it's free. Now, let me quickly add, it is not an alternative to do nothing. We have an aging population. We have people going to the emergency room for a runny nose because they don't have insurance, and we pay for that. So we have to make a choice. If health care reform is the answer, that's okay, but then make it the answer. Raise the penalties on individuals and business high enough so they have to buy insurance, and find $500 billion of savings elsewhere in the budget to pay for it. That's fine. If you're not going to do that, then you have to go back to the drawing board and start again. But I don't believe this law as passed will work simply because the penalties were set much too low.